3 checklists by shocks, okay? But in your syllabuses, there are no answers to them. You should guess which type of shock your patients have on your OSCEs, okay? And according to his clinical manifestations, you should provide the first aid. And the first step will be to detect which type of shock have your patient, okay? 3 syllabuses. You have 1 checklist by CPR with defibrillation. It's 4. Debridement of wound, no surgical stitches, okay? Just debridement of infectious wound, cleaning the wound. 5. You also will have 2 types of fractures, humerus and leg. Immobilization of fracture. 7. And the last one, 8, is the acute airway obstruction. You should show how you will make Heimlich maneuver and cricoterotomy, okay? 8 of them. No stitches, no pleural puncture, no drain and abscess or something like that, okay?
Okay, ma'am.
Clear? Have you got border control on your clinical skills and procedures module? Who was your teacher? Just explained? I haven't made something on mannequins?
He did just CPR.
Okay, but on your examination, you have to show your skills because it's a practical skills and comment it. Comment your actions, okay? Right. For example, in checklists of shocks, you have steps like give a right position to your patient, right? You have to show on the mannequin how will you lift his leg, turn his head, and so on, okay? You have to show which kind of drugs you will use. There will be a group of drugs on the table and you have to choose one of them and explain why do you use it, with which dosage, and something like that, okay? Okay, let's start with the debridement of the wound, okay? Debridement of infected wound. Can you, do you have your checklist in front of your eyes? You know that you can see the criteria, right? Collection of complaints and anamnesis. I think it won't be a problem for you, but try not to spend too much time on that, okay? Main complaints will be an infected wound, pain around it, restrictions of movements, right? Then you have to examine your patient and his wound, but before that, you should explain him your actions, right? Just say that I'm a doctor, I want to help you, but before that, I have to examine your wound, right? Then look at step number 5. Identify possible complications of the injury. That's a theoretical part. You have make something and comment it and tell your examinee maybe which kinds of complications could lead this injury. Which of them, for example, tell me. Hello.
It could lead to reduced blood supply to the specific part, just distal to the injury.
It could be nerve injury, vessel injury,
Yeah.
right?
Yes.
Lymphadenitis, right? You should just describe these processes. If we have a wound, for example, on the arm, some different structures can be injured. For example, if it's a vessel, it could be bleeding, right? In case of that, we can see a bleeding or just see a pale arm cold to the touch, right? Just describe possible complications. In case of nerve injury, it will be sensitivity disorders, right? Or functional disorders of the arm. In case of lymphadenitis, it could be a pain in large lymph nodes, right? Is it clear, guys?
Yes, ma'am.
Yes,
Okay.
ma'am.
Next step. No signs of infection by bacterial population density. Okay. Just describe 3 types of wounds according to bacterial contamination. Which, in general, which kind of wounds do we know? Maybe aseptic, but they are only in the surgery room, operation room, right? During the operation, when surgeons make an incisions. Second is contaminated wound and infected wound. You just have to describe the difference between them. Clear? Can I go to the next step?
Yes, ma'am.
Wound process phases. Just describe, of course, you should read something about that before describing, right? Which phases do we have? Inflammatory, proliferative, and the latest maturation phase. That step is like a step number 6. You just have to name these phases and tell about difference between them. Then leading syndrome to your infected wound is pain, of course, right? I hope all of you knows how to prepare your hands before making manipulation with patient, right?
We know that.
Yes, yes. Hand washing and wearing a sterile gloves.
Doctor,
Yes.
just to act of hand washing, or we have to properly wash the hand?
I think you have to show schematically and describe a process, how you will wash your hands.
And the gloving process as well?
I don't know exactly, but it will be better for you if you bring a pair of sterile gloves with you, okay?
Okay, ma'am.
Okay. Then medical instruments. We just need to make a debridement of wound, right? Using forceps and
Cotton ball.
cotton balls, bandage, maybe, yes.
And
Scissors,
betadine.
Spirit.
spirit, iodine,
Yes, betadine.
and
Betadine.
hydrogen dioxide, right?
ये काय वे लिखना है?
And after that, just show how on the mannequin, it will be a mannequin of infected wound on the arm. Yes, you saw it, I hope. Show how you will make this manipulation. Don't forget that one hand is for sterile forceps, one hand is for manipulation on infected wound, right?
Right, ma'am.
You take from the sterile table with your instruments and cotton gauzes with a sterile forceps something, and then transport it to the second one forceps and make a manipulation on wound and utilize it, okay? We start debridement from the borders of your wound. For example, cleaning the skin around wound. We clean it firstly with iodine, then with spiritus, right? 3 and 3 times. From the borders of the wound to the periphery of the skin of the arm. 3 times with iodine, 3 times with spiritus. Then we remove necropurulent masses from the wound and wash it with hydrogen dioxide, right? And make a aseptic bandage and utilize our gloves and wash our hands. Before starting the procedure, you have to ask your patients, does he has some types of allergy, for example, for iodine? In case of allergy, you don't use these types of drugs, yes?
Okay, ma'am. Ma'am, in the point that we have to remove the necropurulent mass from the wound. How we will do that?
With forceps.
So like we just after using the spirit on the area, we will just act to remove the mass, right?
You sterilize the area around wound, right? Skin with iodine and spiritus. But inside the wound, you use hydrogen peroxide.
Okay.
Mm-hmm.
That is the irrigation process.
Yes. Cleaning process.
Okay. So
And
after irrigation, we have to remove the mass, necrotic mass.
if there's something inside the wound, yes, you should clean it properly.
No, but there will be models, so there would be nothing, right? So we have to just act like we are doing it.
Yes, of course, just show schematically. It's a plastic. You want to remove something from the mannequin.
Okay.
And don't forget, if you have an infected wound, you have to make a bacterial test of the wound, right? You have to take some of material from the wound to the lab test, bacterial test. Huh? Yes, like that. Just tell that you will send some material to culture test, bacterial culture test, okay? Okay, I think it won't be difficult for you. Next checklist, let's discuss acute airway obstruction. Have you tried to make a Heimlich maneuver cricotirotomy on your lessons?
Yes, ma'am, we did.
So I hope you remember the main steps, right? You see, according to a clinical case, for example, yes, you see a person who had choked and now, okay. I'm sorry if the conference will end. We will just renew it, okay? I have something limit to read. Okay, so person can't breathe. He has a fear of death in his eyes. He can't do anything. And you as a medical person should come to him and now look at the checklist. Identify signs of an airway obstruction, right? Difficulty breathing, gasping, loss of voice, agitation, and panic, right? Then you're asked, ask your patient the right question. Right question is, can you speak? Can you try to cough or breathe? In some cases, people can try and breathe, but in our case, no. Yes. Then standard phrase, pronounce standard phrase. Standard phrase is an introducing yourself. I'm a medical student. I can provide a first aid. Please try to be calm. I will help you. Okay? Something like that. And then give him a correct position as on your lessons. Try to make a slaps to his back between shoulder blades. Show it on the mannequin, okay? If it didn't work, you change a position and start a Heimlich maneuver. I hope everyone remember how to do a Heimlich maneuver, right?
Yes, ma'am.
Ma'am, as you, ma'am, remember, ma'am, in our class, the girl students, they were not able to perform that. So, ma'am,
Yes, I know. But I
how?
hope that if you show schematically correctly, it will be good. Okay? Just show schematically and describe your actions. Okay?
Okay.
On the mannequin. Then try to make a force, and you can tell your examiner that you don't have enough strength, but you know how to do this procedure, okay? And
Okay.
then according to scenario, it didn't work, and you start to make a cricotirotomy. Please repeat the names of anatomical orienters and how to find them on male and female. You know the difference, right? Males have an Adam's apple, and that's a thyroid cartilage. Females don't have that one, so we can try to find cricoid cartilage first, starting from the lower part of the neck, right?
Yes,
And
ma'am,
right
from the sternum.
two of these cartilage, there is a cricotured membrane on which we will make an incision with scalpel, right?
Yes.
Yes, ma'am.
So on your checklist, you have some steps, 7 of them, right? And you just have to show it to your examinee. So step 1 is position your patient down, throw back his head, use the roll maybe on the shoulder to make a visible orienters on the neck, right? Step number 2, sanitizing or washing your hand and patient's neck with alcohol or antiseptic. Step 3 is finding an anatomical orienters, right? Identifying this membrane on which you will make an incision. Step 5 is stabilizing the larynx and preparing to the incision. Then making an incision, that's the next step. Don't forget, while using a scalpel or knife, you should control the end of your scalpel to not make too deep incision, right? You should hold it on 1 centimeter of the end, okay?
Okay.
And making incisions and sliding a tube and checking the breathing process.
Finger inside. Then we make another incision
You can
longitudinally. So it's
use a cotton gauze, for example, make an accurate incision, not horizontal, but vertical on your skin, deep to the ligament. Using a cotton gauze to wash the operating area from the blood. And then you make a horizontal incision on the ligament, okay?
okay, ma'am.
Like that. And insert in a tube.
First vertical, then horizontal, then we insert the tube.
Yes.
Right.
यार 5-7 मिनट में कैसे होगा?
Insert in a tube. Tube have a angle form, right?
Yes,
you
ma'am.
should insert it in your incision, not strictly, but rotating from the left to right side and then to the lower part of your neck, okay?
Okay, doctor.
Okay.
शॉप के बारे में बताइए.
Can you please, I have to end this conference, but please try to come again, okay? Right now.
Okay, ma'am.
Coming in the final exam, right? Instead of that, we have shock.
Yes.
Okay.
Not instead of that. We haven't this checklist on a pleural puncture. It's just a practical lesson.
We just practiced it on the mannequin.
Yes, yes. But the checklist will be on shocks. 3 types of shocks.
Thank you so much.
Maybe next year it will be a pleural puncture, but on your OSCEs, no.
फारूक भाई लिस्ट में चेंजमेंट होगी थोड़ी बहुत, इसलिए है वो हटा दिए तो टॉपिक है.
सही लग रहा है.
Excuse me, ma'am.
Mm-hmm.
The doctor at that station will say us what kind of shock it is, or we have to find out.
You have to find out according to a clinical situation, because the first step on your checklist is to determine the type of shock. Okay.
Yes, ma'am. Like we
So the
discussed
clinical
about that.
situation will be given to us on the computer, on the laptop.
Yes, it will be different clinical situations, because if you won't guess which type of shock your patient has, that will be 0 point for your first step. And according to that, it will be incorrect tactics, right? And all your skills will be finally marked as 0. So determine the type of shock is main part of this skill. But here, nothing difficult. We have just 3 types of shocks: anaphylactic, septic, and traumatic.
Ma'am, shock, ma'am, let's discuss shock. Checklist of shock, please. Let's discuss.
Okay, I started it. So 3 types of shock, right? According to a clinical situation. If you...
यार मैम अभी बताने वाली थी कैसे करते हैं.
What? If you have a patient in a shock condition who just received a part of some type of drug, and after that he came to a shock condition, you can guess that it's a type of anaphylactic shock, right? It's an anaphylactic allergic reaction for drug, some type of drug, right?
Okay.
Yes.
Yes, ma'am.
In case of anaphylactic shock, how could you determine it? It will be maybe a collapse. It will be a strict link connection with the drug insertion and reaction to this drug. Maybe it will be an obstructive syndrome, problems with breathing and lungs, but not in every case, yes? So your next action in case of anaphylactic shock is to stop inserting the allergen, right?
Yes, ma'am.
And then you have to ask your nurse or assistant to call the resuscitation team and start providing a first aid before they came. Giving the patient the correct position is a Trendelenburg position. It's the same for all types of shock to protect his brain circulation, right? We lift his legs, mannequin's legs, up to 20 degrees. In which position? Yes, a little bit higher to give the blood circulation up to the head to protect his brain, because in shock condition, he could be unconsciousness. Yes, his main
So
organ will
do
suffer.
it in all shocks.
Huh?
We will do this in every shock.
Yes. Right position is a Trendelenburg position, is protecting brain circulation. Protection brain from hypoxia. Then in every type of shock, you should prevent asphyxia, right? Prevent tongue retraction. So you have to extend the lower jaw of your mannequin and then prevent an aspiration from vomiting, because if patients in shock condition, patients' blood pressure will decrease rapidly and it can lead to vomit. To prevent asphyxia or aspiration, you should just slightly turn his head to let vomit go out, not inside his lungs, for example, okay?
Okay.
Next step is oxygen therapy. In every type of shock, you just give your patient an inhalation of oxygen. Or just give him a fresh air, maybe open the window, for example. If your patient can breathe by himself, you just give him additional oxygen. If he is not breathing, you'll intubate him. But in case of our clinical situations, you just give him an additional oxygen or fresh air, okay? Then, in case of anaphylactic shock, we stop the allergen drug, yes, prevented his brain, prevented asphyxia and aspiration, given him oxygen. Now we should administer him an euphyline or adrenaline. That's the same. Yes?
Yes, ma'am. How much?
How much is a question for you, not for me? We discussed it.
0.1% of the solution, 1 ml.
Okay, in extremal situations, for example, during CPR, we just give 1 ampule. But it will be correct to count. We should give 0.01 ml per kg.
into body weight.
Yes. Okay?
mg.
mg, ml, I'm sorry, ml per kg. Okay. You should comment this step because imagine that your patient had not intravenous but intramuscular insertion of drug which caused an allergy, right? And now he's in shock condition. His blood pressure is too low to find peripheral veins, for example. But you have to give him an adrenaline. In cases when you can find the vein access, you can administer adrenaline
Inhalationally.
How? No.
No, muscularly.
Intramuscularly or sublingually. Yes?
With a higher amount.
Area is rich for blood circulation.
And ma'am, we can also give inhalationally.
Inhalationally, yes, microtrachea puncture, right? But it will be less effective and you should increase the dosage.
Yes, ma'am.
Yes.
So the best way is intravenously, but if you can find venous before increasing blood pressure, you can give it sublingually or intramuscularly, okay?
Okay.
And then after increasing his blood pressure, you should find a venous access, puncture the vein. Yes? And give him an infusion therapy. With which types of fluid?
Prednisolone.
prednisolone.
Guys, I said infusion therapy, not hormone.
Ma'am, crystalloids we will give, and
Crystalloids,
crystalloids
normal
and
0.9%
dextrose.
दे दो ना यार.
normal
Saline
saline,
solution.
right?
Yes, ma'am.
Ring lactate or sodium chloride. Okay, and talking about hormone therapy, how much of prednisolone should we administer him?
1.5 into body weight.
1.5 mg per kilo. It will be approximately 90 to 120 mg. Yes?
Yes, ma'am. Instead
One
of that,
ampulla is about 30 mg.
So we take 3 ampules.
Yes. Okay. After giving him anti-shock drugs, we should monitor his vital signs. Yes. Measure his blood pressure, heart rate, saturation, auscultate his lungs, heart, to check if our therapy was effective or no. If his pressure is still very low, we can repeat administration of adrenaline, right? In which cases should we give him elfilin? We give it if patients have anaphylactic reactions with bronchoconstriction, right?
Like asthma. Asthma or COPD.
It will be, yes, we have a type of anaphylactic reaction which consists of broncho obstruction. In this case, we can give him bronchodilator is eophilin, but we should use eophilin not at the beginning, but only when our blood pressure, systolic blood pressure is higher than 100 mm hydrorgon, right? So you give anti-shock therapy, you control it, you hear, for example, if your patients still have problems with breathing, bronchoconstriction, but you see that blood pressure is increased a little bit, and after that you can give him eophilin to make a bronchodilation. Yes?
Okay.
To relieve his bronchospasm, if he has a bronchospasm. Not in every case of anaphylactic shock, okay? You should comment it. If patient have an anaphylactic reaction with bronchial obstruction, I administer him a bronchodilator, eophilin, for example, but after increasing systemical pressure a little bit, okay? Because if you give, if your patient still have a low blood pressure and you give him eophilin, you can decrease it more, his pressure, okay? Is it clear?
Yes,
In
ma'am.
which, okay, next step, antihistamines. In which case we should give patient antihistamines? If it's a
Hypersensitivity reaction.
rash on his skin from allergy reaction, okay?
Allergic, yes.
Allergic rash, yes. And then after that, you again check your anti-shock therapy by measuring his pressure, pulse, and so on, and making auscultation. And then let's imagine that your actions was effective and patient's condition was improved. So by which criteria? He came to his consciousness, He can breathe by himself. Yes. His blood pressure lifted to normal rate, and his skin became pink and again, okay?
Okay.
By this criteria, you can say that your anti-shock therapy was effective. And your further tactics. In case of anaphylactic shock, you can't let your patient go home. You should leave him to observation in the ICU unit. Hospitalization to the hospital up to 72 hours, minimum 3 days, okay?
Okay.
Okay, I hope it's clear.
Yes, ma'am.
Next type of shock is septic shock. By which criteria you should suspect a septic shock on your patient. If he is in a shock condition, right? Low blood pressure, maybe losing consciousness, and if, according to a clinical situation, from his anamnesis, you know that he has an infectious in his organism, okay? And this infection causes an inflammation, intoxication, and this process leads to a septic condition and septic shock, okay?
Yes, ma'am.
So, in case of anaphylactic shock, your patient inserted some type of drug and immediately he feel bad from this drug. And that was an allergic anaphylactic reaction and anaphylactic shock. In case of septic shock, your patient had an infection process, or maybe surgical infection in his organism, abdominal infection, for example, right? And his condition became worse because it leads to a septic shock. Algorithm, some steps will be the same. Instruct the nurse to call the resuscitation team, give him a correct position, protect his brain, lift his legs a little bit. Prevention, asphyxia with extending the lower jaw. Preventing aspiration and vomit by turning his head, giving him an oxygen. Then providing an access to the vein, and it should be a wide catheter because your infusion therapy should be massive, okay? Wide venous peripheral catheter. Monitor insertion urinary catheter, catheterization of the bladder, because in shock condition, in septic shock, while giving him a fluid resuscitation, you should count a urine output. Yes? To know, is your fluid therapy adequate or still not? Because in a sepsis condition, the real function will be damaged, right? Okay, next step is monitoring his vital signs. Then give him, after inserting a wide venous catheter, giving him a fluid therapy. You know the normal rate of fluid therapy? How should we count how much we have to give to our patient, the amount of fluid. Guys, it's a lessons teams, not consultation question. You should know. You have a syllabus, you have a links, you have a books. You just have to find out the information and read it. My group, we discussed it. Who can answer me? Amount of fluid therapy. How should we count?
By the way,
Arbas. Oh, 30 to 40 ml per kg. It will be approximately 2000 ml to your patient per day. Yes? But in case of shock, you should give the first part of fluid as soon as possible. So, for example, the first liter of fluid should be given in the first 10 minutes. Half a liter to a liter, yes? And the ratio between colloids and crystalloids should be
3:1.
Yes, 3 parts of crystalloids and 1 part of colloids. Because if you just give your patient 2 liters of crystalloid, it won't be held in a vessels. It could come out to the tissues. To hold the liquid inside the vessels, you should give colloids. Okay? Crystalloids is a normal saline ringer lactate, 3 parts of crystalloids. If you give him a 2 liters of fluid, 1.5 liters should be normal salines, and half of a liter should be colloids, something like gelofusine, dextrose. Okay? I hope you write down all of this information. Who doesn't know? Okay. Then this sepsis condition includes hormone therapy too, right? We discussed how much of prednisolone should we give to a patient. Then the main step of septic shock is adequate fluid therapy and antibacterial therapy, right? Because without treating an infection, you can't lead a sepsis. So you should give him antibiotics. Which kind of? It could be a mix of cephalosporins for 3rd generation, for example, yes, and ftorhinolones.
And?
Ftorhinolones. We should start empirical antibacterial therapy with wide spectrum antibiotics, right? But in it's a first aid, but in treating process, we should make a culture tests, blood maybe, and administer antibiotics due to sensitivity, I'm sorry. Okay, antibacterial therapy. Then anticoagulant therapy. In case of shock, under the action of bacterial toxins, we have a high risk of thrombosis, thromboembolism, right? Because these toxins make a reaction to our coagulation system and will be a huge risk of clotting. So we give him anticoagulants. Heparin, standard dosage is 5,000 units intravenously. In case of first aid, we give heparin. But in the long-term treatment process, we give small molecular heparins. Yes, but this is emergency tactics. Okay. Next step. Imagine that you administered adequate fluid therapy, gave him a hormone therapy, but his blood pressure is still low. So we use vasopressors, right? Catecholamines to increase inotropic action of heart. We administer dopamine. In which dosage? Okay, name me a low dose. The correct dosage comes in micrograms per kilo per minute. So we use from 5 to 10 micrograms per kilo per minute, starting from 5 and checking his pressure and increasing if it needed. Okay. Then we check vital signs again. And if your anti-shock therapy was effective, you name the criteria, they're still the same. Patient's in consciousness, he can breathe, his skin is pink, and he has a normal rate of blood pressure. Further tactics is to continue treatment in hospital. Okay? Patient in shock should be laid under observation in ICU. Next type of shock is a traumatic shock. Nothing hard. A patient with a trauma whose blood pressure is very low and he has maybe problems with consciousness and breathe and so on, right? Traumatic shock includes two types of pathologic processes. It's could be hypovolemic shock because of bleeding, hemorrhage, right? And pain. Combination of two of them makes a traumatic shock. How could you suspect a hypovolemia on patient? Is the low systolic pressure and a high pulse. yes? Pulse rate more than 150% of normal rate. And of course, pale skin, cold fingers. What should we do? First of all, we should control his breath. If he can breathe, give him an oxygen. Then stop the bleeding if he has a bleeding, right? You know how to stop arterial and venous bleeding, I hope. You just comment, in case of arterial bleeding, I make a tourniquet on this area. In case of venous bleeding, I make these actions, right? Don't forget to fix your tourniquet and make a note with time, because in summertime we can hold tourniquet up to 1.5 hours, and in wintertime only a half an hour, right? Then we have to choose the position of tourniquet, or it could lead to necrosis of the arm or leg. We should use a tourniquet, not skin, because we can damage the skin, but with some tissue. Yes?
Yes, ma'am.
Yes. If it's not just a bleeding, but a wound with bleeding, we apply an aseptic bandage to this wound to prevent infection. Then, after stopping the bleeding, we give the patient a right position, lifted legs, yes, Trendelenburg position. Then we provide an access to venous channel to start a fluid therapy, because he is in hypovolemic shock, right? There should be a wide diameter of needle, because we will give him a lot of liquid, as we counted 30 to 40 ml per kg, crystalloids to colloids in ratio 3:1, right? That's the first part of shock, hypovolemic. And the second part is the pain. We should reduce his pain by administering an analgesics, right? In which combinations? It could be a tramadol, 5%, 1 to 2 ml, plus diazepam, 0.5%, 2 ml, for example. Or fentanyl, percentage of fentanyl is 0.005%. And there is 2 ml in ampulla. Then you monitor his condition, check his vital signs, and then name the criteria of improvement: consciousness, effective breathing, normal blood pressure, and decreased level of pain. Then you transport him to the ICU, because it's a shock condition, okay? So in traumatic shock, you should show how to stop bleeding, give him adequate analgesia and adequate fluid management. Okay?
Yes, ma'am.
Okay.
Okay. Please reconnect. We have 3 checklists. Okay?
Okay, ma'am.
تشكى الخير، تشكى التنمية، تشكى تلك البقعة التي تعتلي
Okay,
شريان
that's all.
التمويل
18 of you, 19. Okay, let's discuss immobilization of fractures. Have you tried to make an immobilization on your practical lessons? Hello?
No, ma'am, we didn't have much classes.
Which group? Who was your teacher?
Miss Roshan.
Have you seen this procedure?
Yes, ma'am, on YouTube.
Oh my gosh. Now there are exam sessions started in simulation centers, so we can't go and practice for ourselves because there are exams from the morning till the evening every day. But I hope your YouTube lessons will be effective for you, because on OSCIS you should show how you will make a construction for immobilization, how you will make a bandaging. Two types of fractures, humerus and leg fracture. Nothing difficult, just listen. I don't know, maybe you will listen to a patient, or it will be just a clinical case when a patient complains about a pain in a leg or arm after falling down on the ice, maybe. Shoulder. Yes. Shoulder and leg. Just collect the complaints from your patient. He can tell you that he has a pain in his leg or arm. He can't move. Yes. And after that, you should, maybe you will see his X-ray. Then on the site of the injury, it can be a edema, hematoma, maybe crepitation, right? It will be a closed fracture, not open, so you don't have to stop bleeding. You just have to immobilize his limb and transport him to a hospital, okay? Which possible complications of fracture could patient have?
It
They are
could
same as
Septic shock.
right. It could be injury of blood vessel, maybe it will be hemorrhage, maybe it will be a huge edema, and also lead to impaired blood supply. Maybe it will be cold, pale skin on the injury site. Yes, we should check pulsation in this area and nerve sensitivity. Yes, that could be a possible complications, impaired blood supply and nerve injury. Type of fracture will be closed because it won't be a wound or bleeding, right? Signs of the fracture, you should name them. 2 types of signs, absolute and relative. Absolute signs of fracture is a deformation of the limb, visible deformation, shortening of the limb, maybe pathological mobility in the fracture area. And if it's an open fracture, it will be visualization of bone fragments, right? And relative signs is the pain, edema, and limitation of mobility, and maybe hematoma. Oh, yes. Okay. First aid is reduce the pain, then immobilization, and transporting him to nearest hospital. Leading syndrome is the pain. Before starting immobilization, you should prepare your hands, wash them. Maybe you should use an anesthetic, Novocaine. Yes, it's a local anesthesia to the fracture site. And then you have to show how to make immobilization with Kramer's tires. If it's the arm, you should fix it in a physiological position, make a construction. You should make all constructions on the healthy side, right? Or the measurements and form of construction. And after making it, you should place it to an injured site. Okay?
Okay, ma'am.
Okay, ma'am.
So just show, don't forget about preventing areas where bones are close to skin, to make a cotton gauzes between your Kramer's tire and arm. Yes? To the elbow, to the shoulder. And if it's a leg, you should put a roller under the knee to make a physiological position, right? And just show it to your examining. That's a bone fractures. Have you ever any questions on fractures?
No, ma'am.
Okay, and the last one is the CPR. I hope all of you practiced on CPR on lessons and now how a defibrillator works.
Yes, ma'am.
Yes, ma'am.
Any questions on CPR?
No, ma'am.
I wanted to know, like, what is NAT solution?
Please, one by one.
Salt solutions.
What is your question?
Ma'am, I wanted to know what is NAT solution that we have to give in the 5th point in the CPR.
Which solution?
NAT solution.
Which step?
Ma'am, in the 11th step.
It's a normal saline, I think. In fluid therapy, we start all infusions from normal salines. Okay? from crystalloid. So I think it means
what it is given in 5th point, like a venous access with the connection of a system for transfusion of solution. So in the 5th point, we have to just connect the system, or we have to transfuse some solution as well.
fifth point?
Yeah.
Or 11th step?
In 5th point, it is given like connection of a system for transfusion of solution. So we have to just put the connection, right? We don't have to infuse right now. We have to infuse in the 11th step. We have to infuse something in 5th step as well.
Yes. Okay, in case of CPR, the main steps is to start compressions, breathings, and administer patient drugs, epinephrine or adrenaline, yes, they're the same, every 3 to 5 minutes. Then if there is asystole on the cardio monitor, if there is no shockable rhythm, you administer an atropine, right? And in which case we should use defibrillator?
Ventricle fibrillation.
Yes, in case of shockable rhythms. I hope all the groups discussed CPR with defibrillation, discussed type of rhythms in case of clinical death, shockable and non-shockable. In non-shockable rhythms, we don't use defibrillators because there is no fibrillations. There's just a straight line on the ECG, for example. In this case, we use epinephrine with atropine. In case of shockable rhythms, is ventricular fibrillation or pulseless ventricular tachycardia. We use defibrillator to remove these fibrillations, right? In this case, we use defibrillation, epinephrine, and antiarrhythmic drug amiodarone. Okay? Have you got any questions on CPR?
Ma'am, can we just tell you the sequence once of the CPR?
What?
Sequence, like one cycle of the CPR, then first defibrillation, then second cycle, and like after second cycle we have to administer the drugs, or after the third cycle?
First of all, you have to use defibrillator as soon as it will be ready. And you use adrenaline after the first cycle.
Okay. And like while administering, we have to continue the CPR. So we will be just leaving the CPR cycle, then administer the drugs, then continue with the CPR cycles again.
No, while administering the drugs, you ask your assistant, for example, or just comment to your examinee that I'm administering epinephrine. You stop your cycles only in three cases. First, when defibrillator is ready and your assistant tells everyone to go away and make shock, and then you continue. Yes? Second is a stop control, when you check vital signs and rhythm, and immediately after that, is there no effect on your CPR, you continue it. And the third point, when you stop cycles, is when the patient's condition improved and he has a pulse and breathing.
Okay.
Okay. So
Okay, ma'am.
at the beginning of
Excuse me.
manipulation, we should check pulse only on magistral arteries. Okay.
Ma'am, how many stations do we have?
Where? On
I mean,
CPR?
surgery. How many stations?
8 checklists, but I don't know how many stations. I'm not on examen committee. I'm just I think I'll be on one of the stations, but I don't know on which one and how much it will be.
Okay, ma'am.
So, do you have
So those stations will be changed or not? Because there are only 8 checklists, and like the models will be, which models are specified? Like, do you understand my question?
You ask me how much stations should you pass? I don't know.
Ma'am, the stations will be changed. Like, there are 3 stations. One have CPI, second will have something coniotomy, or the third one will have the wound cleaning. So they will be changed or not?
For everyone.
I don't know. Any questions?
No, ma'am.
No, ma'am.
Okay.
Thank you so much for the consultation.
Thanks a lot, ma'am.
Good luck.
So much, ma'am.
Mhm.
Good night, ma'am.
Bye.